Hi, everyone. This week I'll be discussing the psychoanalytic theory and the Adlerian theory, along with similarities, differences, and situations where each approach may be beneficial for your client. So, the psychoanalytic theory was developed by Sigmund Freud and focuses on how unconscious thoughts, early childhood experiences, and unresolved conflicts influence present behavior. Freud believed that people often operate from unconscious motivations and internal struggles that shape the emotions and their relationships. So, concepts like defense mechanisms and the unconscious mind, the id, the ego, the superego, and important parts of the psychoanalytic theory. So, the overall goal is to increase self awareness and to help the clients gain insight to unresolved issues. Adlerian theory was developed by Alfred Adler, who originally worked with Freud before developing his own approach. So, Adler believed that people are motivated by their goals, their purpose, their social connections, and their desire to belong, rather than just focus mainly on their unconscious conflict. Adlerian theory emphasizes family dynamics, your birth order, your feelings of inferiority, and how individuals create meaning from life experiences. So, although these theories have some differences, they also share some similarities. Both approaches recognize the importance of early childhood development and experience, and they believe that your past influences your present behavior. So, both theories emphasize that the insight and your self understanding is just as important parts of your change. Additionally, they both examine your family experiences and how early relationships shape personality development. However, one of the biggest differences is their view of human motivation, how we are motivated in our lives. So, psychoanalytic theory focuses heavily on the unconscious drives and the unresolved internal conflict. So, the Adlerian theory is more future oriented and it focused on your purpose, your goals, your strengths, and your social interests. So, Freud often explored pathology, unconscious impulses, and Adler focused on encouragement and helping individuals identify their strengths and their belongings. A client may benefit from psychoanalytic therapy when their unresolved childhood experiences seem connected to their current life situations, their current problems. So, someone struggling with long-term relationship issues, repeated patterns of behavior, unresolved trauma may benefit from exploring their unconscious themes and gaining insight on that. And this is according to Cherry 2024. Psychoanalytic approaches can help individuals understand the underlying emotional conflicts and their recurring behavioral patterns. A client may benefit from the Adlerian theory when issues involve self esteem, family dynamics, identity, or the feelings of inferiority. I got it that time. Personally, I find that the Adlerian theory is interesting because it focuses on understanding a client within their social environment rather than just viewing them as one individual. Like that's their problem or that's their situation. So since I'm interested in family systems in my path and trauma and substance abuse counseling, I can see Adlerian concepts fitting a lot better in my practice as opposed to the psychoanalytic. So Very Well Mind also discussed how Adlerian therapy focuses on encouragement and helping others recognize or helping clients recognize their purpose and their strength, which this supports positive change and personal growth. So overall, both theories contribute their values, and they are very valuable. So Adlerian theory feels more aligned with my counseling style because it focuses on the relationships, the belonging, and the understanding of the whole purpose. And I look forward to everyone's thoughts and perspectives this week.